Hi everybody, a very good evening. This is me, nutritionist Dhvani Shah, and I'm here with a nutritionist Vallari Shah. So let me do a quick round of introduction before we begin. So we are going to be speaking on how home remedies and how food helps improving lung health, and also some lifestyle tips that you can take home to work as preventive measures for any lung diseases that might come during the winters or even as a part of the COVID-19 infection. So I am a nutritionist by profession. I have authored 7 books and conducted more than 250 workshops. And it is my passion to make food as medicine, and that's how I'm here today. Let me also invite nutritionist Vallari. Vallari, can you just do a quick round of introduction for our attendees?
Definitely. I'm honored to be here with you, Dhvani. I Hello everyone. Hope everyone's doing great and staying safe at home. I'm Vallari Shah. I'm a lifestyle and a sports nutritionist. So I've been practicing nutrition consultation for past 9 years, and I'm here to tell you the home remedies for lung health and how in this COVID situation, plus with so much of air pollution, the viral coming in the picture, how can you take care of yourself at home and protect yourself? Do you want to start with the session, Dhvani, now?
Yes, Valerie. So, Valerie, why don't you start by telling everybody what diet or what food should they be including on a day-to-day basis for good lung health?
So, firstly, let's understand why lung health is important. Now, this lung health is crucial because it supports our bodily function. Okay, the respiratory health is can lead to chronic alignments and very low in immunity also, especially now COVID situation, the winters, the virals, everyone coming in the picture. Okay, it's very important to keep your lung muscles very healthy. Okay, so now the foods which are rich in antioxidants can be very helpful to protect your lung health. Food like apple, walnuts, garlic, turmeric can be very helpful in protecting your lung. So when we include such foods, it increases your immunity, and thus it even increases your lung health.
Correct.
Yeah.
Right, absolutely so.
You want to
So
add
I would
something
like to just add a point here. According to Ayurveda, our body is divided into 3 constitutions as Vat, Pitta, and Kapha. And lung diseases usually fall into the Vat segment or the Kapha segment. And it is said that if a person is suffering from things like dry cough, or if you're prone to developing a lung infection, throat infection, or cough during the colder seasons, then the foods that you should be eating are more of they're called lubricating foods. So things like nuts, seeds, you can have avocados, you can have egg yolks, you can have your ghee and cold pressed oil. So you should be lubricating the lungs because the lung linings dry out. And if you're the Kapha Prakriti person, that means that if you are generally a person that puts on weight very easily, and if your lung symptoms come out as mucus, or if you have runny nose, that kind of symptoms, then the food that you should be going in are foods that generate metabolic heat. So ingredients like bajri, ingredients like nachni, ajwain, then tulsi, amba haldi, amla, all of these ingredients work really well for this type of a body. So these are the ingredients that you should try using more and more into your everyday cooking, especially from December to around February when the weather is still cold. And As Valerie rightly said, lung health also depends on the season, and because it's important in the COVID-19 situation, more than treating your problems, focus on preventing the problems, and this is how you can understand your type and use the preventive remedies accordingly. So, yes, Valerie, over to you.
So tell me, what are the home remedies for good lung health?
Okay, so along with the ingredients, there are these 2 to 3 home remedies that I've found really, really effective to prevent any lung disease. So, if you're a patient of asthma, if you're a patient of bronchitis, or if you're suffering from any chronic lung diseases, or even if you have allergy issues, weather changes and you have like cold, cough, sneezing, or you're allergic to dust, you're allergic to pollen, then there are these 2 remedies that I would mention to be used on a daily basis, and that's what works miracles for the clients I recommended to. So the first is a decoction. It's an infusion that is made by boiling tulsi, lemongrass, mint, and ginger. And after you boil it for a bit, you make it like a green tea. You can just squeeze some lemon and add some cinnamon powder to it. So this tea twice a day, excellent for lung health, excellent as a preventive, excellent as an immunity booster, especially during this COVID-19 situation. And the second remedy would be it's a blend of ginger juice, honey, haldi powder, and a little bit of ajwain powder. So this remedy at bedtime really helps improve sleep quality. It helps remove the phlegm from the lungs or from the throat or nose wherever it's accumulated, and it also helps kind of open up the air passages so that it makes breathing easier if you have cold or cough. So don't worry, I'll just type out these remedies in the chat box for those people who have missed it. But just remember 2 cups of the warm infusion and 1 spoonful of this juice at bedtime, around 30 minutes before bedtime, works really, really well for good lung health. And, Valerie, why don't you tell us a little about the alternative home remedies for good lung health and for prevention of any type of lung problems?
Definitely, as you rightly said, Dhvani, like these kadas that you mentioned right now are so traditionally in the Indian culture that do wonders. But there are so many other alternative measures that you can take to protect and boost your lung health. Okay, the simplest form is the steam, like therapy. Everyone takes steam. So when we take steam, the water molecules, when they enter our airway, they clear the mucus from our lungs, which makes us let us breathe easily. Especially it's very much required right now where the COVID situation is there, and we don't even want the smallest of viral happening. So we think that we are getting into the corona phase. So when you take steam therapy on the regular basis, when your mucus line is clean, it will help your lung health. Second point is exercising regularly. Now when you exercise, it forces the muscle to work hard, which increases the breathing capacity. Okay, and it leads to great supply of oxygen to the muscles. When it
Correct.
yeah, so it even improves your circulation of the body and making the body more effective to like remove the excess carbon dioxide. So that also helps in your lung health because your lung doesn't have to work hard to push out the carbon dioxide, excess carbon dioxide that is stored in your body. Third is growing homegrown like house plants. Now everyone knows that what do plants do? They inhale carbon dioxide and they exhale oxygen in the time of photosynthesis. Okay, so they act as a natural air purifiers. So how much ever plantation we grow, anyways, we are lacking on the green part of it when we are staying in cities. So it's better to have homegrown indoor plants. So your oxygen, supply increases even when you're home. Third is pranayam. Now, pranayam is so much famous in yoga. Okay, it's just a simple exercise of breathing in and breathing out. But even when you do that, it helps your a lung muscle expand and relax with time, and when we are holding it, it improves the muscle strength. So when you do it on daily basis, that also increases your lung health. And last is, this is a very, like, a different technique. It's called balloon blowing exercise. As kids, we all have done it, like, blowing balloons and, like, getting out. But this exercise actually, like, helps our muscles, like, expand and elevate when we're talking about diaphragm and your rib muscles. So your lung muscles are exercising when you're doing this exercise. And in the long run, you will see the difference of how much your lung muscles have improved, and even your immunity has increased because of that. I would really suggest this exercise, especially for people who are suffering with asthma or bronchitis, to at least, it's simple, yeah, two to three balloons you take per day, just blow it, blow out whenever you have free time. How much time does it take? But it really will, in the long run, you will see the difference.
Okay, that's interesting. So I hope all of you have made notes in this, because it's not just food, but lifestyle is also equally important to support food. And as Valerie said, there are so many things in terms of exercise and like, you take steam fermentation to supplement your lung health and to keep your lungs healthy. So yes. So guys, please remember, if you have any questions for us, please write it in the chat box and we'll try to answer them as time passes. And any please restrain your questions to lung health only. Okay.
Okay, Dhvani, I want to ask you a question. Tell me, like, what food should we avoid to, like, maintain a good lung health? Like, I'm sure there will be dozens
Right.
of foods that we need to avoid.
Right. So, there is this notion, I'm sure you've heard of this. People think that, okay, if I have asthma or if I have some lung problems, I should not be eating thanda food. So, it's not the temperature like refrigerated food or iced food, but they also think things like, okay, I cannot eat papaya because it might be thanda, or I have to eat papaya because it's garam. I've heard both sides of all foods possible. Okay, how can I eat rice? वो ठंडा होता है. How can I eat jeera pani? So, I would like to mention here that food is not hot or cold. It is, it is hot if it stimulates the metabolism. But more than hot or cold, we have to look at how acidic or alkaline it is for the body. So if it is acidic, then yes, it's going to generate more heat, but it is also going to have those kind of side effects. If it is alkalizing, it is also healing. It's not just that it is cold for the body. So please don't go by that bifurcation and avoid all the natural ingredients because you think it is cold. But you should avoid high nitrogen generating foods. So foods that are high, all most ingredients generate nitrogen, but there are these ingredients that generate it in a concentrated amount, especially high GI foods like, your concentrated carbohydrates, refined sugars, you have high fatty foods. So all of these foods generate a lot of nitrogen. It puts an extra pressure on the lungs to eliminate it out. So, that is highly, avoided on the list. You should always try avoiding foods that are processed, and especially foods that have a lot of additives, flavoring agents, coloring agents, because they are shown to cause elevated lung allergies. People, get cold and cough immediately if they have such foods. So avoid processed foods, avoid foods that are simple sugars, avoid high fat foods. And most importantly, it is said to avoid foods that are sour in taste. So, things like tomatoes. So according to Ayurveda, lemon is not really sour in the like the
When you
uh,
consume it,
constitution configuration. Yes. So the foods that fit into this category is imli and tomatoes, and that is what shows really improved results if avoided in lung health. So you can go ahead and eat lemon. You can have kokum as the khatai in your food. So kacha curry, imli, tomatoes, please try avoiding these foods. Please try avoiding foods that are high fermented foods, especially idli and dosa batter that is fermented for more than 6 hours. So that's when it converts to sour food. So these are the primary avoided foods as far as the naturopathic angle of the diet goes. And Valerie, do you want to add something, that modern nutrition would tell us about avoiding foods for lung health?
So I would really say that, even, avoiding alcohol and alcohol, tea, coffee, all that also would, help in, preventing the lung health with the caffeine intake and everything. As much as we keep it minimized, that is much better. So the body doesn't get too strained. Of course, we'll be talking about the macronutrients later, where we, we'll talk about it, how carbohydrates, proteins, and fats also have an effect on it. So
Yes,
that's also
yes.
the things that should be, kept in consideration when a person is having some lung health issues.
Correct, correct. And so you were mentioning macronutrient intake. So how does it affect the carbon dioxide and oxygen balance of the lungs, and how should the balance be?
This goes a little technical, but I'll explain you. The amount of carbon dioxide that is produced from the food, okay, differs depending on whether you're having macronutrients like carbohydrates, proteins, and fats, which are the three main macronutrients. Okay, we measure the respiratory quotient, okay, the ratio of respiratory quotient, by comparing how much carbon dioxide is produced relative to how much oxygen is consumed while metabolizing any of the foods that we do intake. Now, why this respiratory quotient is important for our body? Because the more carbon dioxide is created, okay, the more our lungs have to work hard to exhale it out. Now, carbohydrates per se has the most highest amount of respiratory quotient, that is 1, where
Hmm.
protein is in middle, 0.8, and fat is least, it's 0.7. So in extremely simple terms, when we fry something, or when we're making parathas and all at home, there's so much smoke which is produced, and we need a chimney as a ventilator to get out the smoke, to clear the air in the house. The
Hmm.
same way, when we take in carbohydrates, the burning and the smoking happens a lot more than we have fats in our body. So our lungs have to work much more harder to ventilate, remove the air and clear out the ventilation inside our body,
Right,
especially
right.
to people with high lung diseases, or which are like chronic asthmatic, chronic asthma patients, and all those people, they may not be able to do that, and the carbon dioxide in the blood will increase. So the diet per se changes, where they have to take carbohydrates in low proportion, where you take high protein and high fat diet. That would work better for them. Of course, for a normal individual, they don't need to get into this. But if a person has a low lung health, they definitely have to go to their nutritionist or a doctor, okay, and consult them and get the diet change.
Right, right. Okay, so that's interesting. And would you want to give examples of some maybe like a balanced meal or some recipes that you think would work to balance the carb protein fat ratio?
So I would definitely tell, the foods like maybe quinoa are there, eggs, which is there, fish, and veggies, when we put a fish and veggies combination, where we are having a good amount of protein plus vegetables in it. If you want to add an avocado to have like a balance of good fat in it, you can have a salad with a little bit of feta cheese in it, with walnuts, so it becomes like a wholesome meal in itself. A quinoa khichdi would be doing wonders, because it has amazing amount of protein, decent carbs also, a lot of vegetables again, which is high in fiber. Yeah, so that is something that we can
Okay,
include in the diet.
okay, okay, that's great. That's great. So, yes, people who have questions, please do keep posting in the chat box. We have received a few, but please do keep posting. We'll address them towards the end of the session.
Dhvani, I would like to ask you, can we eat curd at night? Like Ayurveda says that we can't eat curd at night. So any person with lung infection, can they consume curd?
So, well, that's true in Ayurveda. They say that curd should not be eaten at night. So, how milk products are divided here is milk is supposed to be had in the second half of the day, especially like bedtime milk, and curd has to be taken in the first half of the day, like for breakfast or lunch. Now, it is a widely known fact that people who have curd in the night, even though they don't have any problems of a respiratory infection or a lung disease, they still do develop cold if they have curd in the night. So it's not that you cannot have curd, but if you must have curd in the night, it's advised to put a tadka over it. Like, do a vaghar with some ghee, jeera, kari patta, etc. And, add it to the curd, or you transform the curd into something like a kadhi, so that's an emulsification of the curd. So when you do it that way, like technically when the curd is cooked, that's how you can have it in the night, like at dinner time. But if you must have it in the day, always prefer freshly set curd, non-refrigerated curd, to avoid any sort of cold cough or throat issues, etc. And try being safe from the COVID pandemic.
Sure, that's interesting. Like I
Yeah.
didn't know the Ayurveda angle, so that's very interesting to know.
So, in fact, it's not really different from how the modern day nutrition works. It's a very beautiful amalgamation. The only thing different in Ayurveda is they also tell you about the constitutions and how certain foods are, to be added for those constitutions. But overall, if we see the guidelines, it's very much in sync with modern nutrition. And you were mentioning antioxidants and how it is important for lung health. That's also a concept in Ayurveda, like phytochemicals, antioxidants. They play a very important role in any healing processes in the body. So, Valerie, why don't you say how antioxidants are important for lung health, and what type of antioxidants can we add in our daily food intake?
Antioxidants are required in our body. See, there's a lot of external factor nowadays, like playing a role in lung health is where stress is involved. People are into smoking. There is air pollution, and all of these things, like start producing free radicals in our body, and free radicals lead to lung damage, and all of those things in the future. So when we have antioxidants, especially rich in beta carotene, vitamin C, and other, like other vitamins and minerals that we take it in picture, and we have a wholesome meal, they protect and give us a good immunity in future.
Right, right. So what foods can we include on a daily basis to get antioxidants, and that can be easy to add antioxidants in the diet?
The fruits are wonderful, like uh, food that can be included, especially things which are high in vitamin C, like oranges, all type of berries. If we go to see, papaya is there. So apple is there, which is a normal fruit which is available to everyone. Mm, um, grapes are there, so all kind of fruits can be included to have, like they are rich in antioxidants. Okay, nuts like flax seeds there, pumpkin seeds are there, walnuts are there, which are again rich in antioxidants. Herbal teas like green tea is very rich in antioxidants. So if you have 2 or 3 cups of green tea per day, it's extremely low in caffeine, but it's rich in antioxidant. So
Right.
that you need to include in your daily diet.
Right, right. So interesting, like when you say about fruits, there is this concept in the Siddha medicine. So Siddha medicine talks about the six tastes that the tongue has, like our six taste buds, and how each taste buds relate to some foods. So for lung health, it is said to have more of astringent foods, and in fruits, like all of these high vitamin C or antioxidant fruits, like you mentioned, pomegranate, berries, apple, guava, um, I would say amla. All of these are said to be the astringent foods that really improvise lung health. And, again, it's the winters, and these are the foods that are really available right now. So I think,
It's
yeah.
the thing, like, so it's like the season matches with the fruits we're supposed to have right now.
Exactly. So seasonal matches lung health, good as the astringent bit of the healing bit of the lung health. So please, guys, go ahead, eat more of these fruits. Don't just go for fancy mandarins and grapefruits and passion fruits. Please opt for these traditional fruits. So you also have these rambutans. I don't know, you call it as ramphal in some places. So that's also excellent for lung health. Please have that. Please have your amba haldi. You have this fresh like ginger shaped haldi that's available. Please have that. So that is really good. Like, it has your antioxidant, it has your phytochemicals, it has these healing properties in them, which is excellent to combat any lung disease during the winter and during the pandemic. So, well, that was really interesting. Yeah.
Like you mentioned the amba haldi, and generally amba haldi is fermented in the lemon juice and they are kept. So like
Correct.
lemon is also soaked, so you get a proper proportion. It's like a homemade pickle and it is so high in,
Correct.
so it's like a perfect dose of, like, a good immunity booster, like that you can include in everyday diet. That was such a good tip that you gave.
Yes. And this combination that you mentioned, like, so when it's fermented, it also gives rise to those enzymatic actions, which improves gut health also. And, we all know gut is the base for all diseases. So, we need to heal the gut as well. Awesome. So we have, Animesh, it's called Kacha Haldi as well. So we have some questions from Neil. He does say, does NAC help to break down mucus? So Valerie, would you want to answer this?
Can you
So NAC, Anil, if I'm not mistaken, you're referring to N-acetyl cysteine, if I'm not wrong. It's a supplement that's usually available. So, honestly, I would not really want to comment on this because it's more of a doctor's prescription that comes on this. But I would say, if there is a chronic mucus issue, you would want to go in for home remedies. There's nothing long term and sustainable as your home remedies and as your diet to break down mucus. So, let's leave the medicine part to the doctors.
if you still feel, you can add few drops of eucalyptus oil maybe, and then use it like the inhalation part of it when you're taking your steam therapy. I think that would also open up and, like, free your airway for the mucus part.
Right,
Try that. I think
right.
it's a good one as well.
Yeah, I've also heard that, if you put it on the handkerchief and just smell it, that can also work.
Yeah,
Yeah.
it can.
Okay. Misha says, can salad be eaten? So, well, I think salad, honestly, raw food is something which, um, in like in naturopathy, they say you should not be having it because it's again the cold tashir of foods. But I would recommend sauteing it a little bit or steaming it slightly to make it digestible for lung health patients. See, if you have cold cough, please do eat salad, room temperature fresh salad. But if you are a asthmatic, if you have COPD, if you have any other lung disorders, then I would recommend cook the vegetables slightly before eating them. Okay, we have foods that cause overproduction and what can be done to avoid it. Valerie, why don't you answer that?
Um,
So Dipesh says food that cause mucus overproduction and what can be done to avoid it.
so I think you want to talk about from the pitta angle here.
Yeah, so basically, it said that mucus is linked to the kapha prakriti, and people who have a higher of this constitution in the body produce more mucus. So kapha prakriti, they don't take very well to milk products. So any form of milk products, it can be milk, yogurt, paneer, cheese, etc. So if you have a chronic issue, you might want to reduce the intake of milk products, or stop it for a while, and once the situation is better, gradually add it back in very small limited quantities. So that is the thing that causes overproduction. And you can have the home remedies that I mentioned earlier to avoid it, like the infusions, the juices, the ingredients that I mentioned that can help you. So well, I don't think we have any more
I
questions.
think, like, the modern nutrition really tells about any food that aggravates, like,
Yes,
production. It's just avoiding of cold foods or cold drinks or anything like that would be a,
yes, yes.
none of the foods as such, like, promote or produce any kind of nutrition.
Correct, correct. It says more of catching a cold type of foods than mucus production.
But it's not related to, like, as such food that
Yeah, yes, yes, I agree. Well, so I think we can call it a day and wrap up for today. Valerie, do you want to do a closing note?
it was such a great session, and it was so great to have you, Dhvani, along with me, and the question answer round going on. Audience, you all have been great. If you all have more queries and more questions, please leave them here so we can answer them later on also if you have any questions. And thank you, Fast Up, for this webinar.
Thank you, Valerie. It was so much fun to do this session with you. Thank you, Fast&Up. Thank you, Vijay. And thank you, everybody, for being there. And I think the one thing that you can take away from the session today is there is a lot in your kitchen and around you that's available to boost lung health. Please make use of it. And please stay safe, stay healthy, keep your family safe, and well, I would say live life the nature's way.
Very much. Now that the second wave is what is coming up right now, I would just say stay safe, stay home, and just be careful. Just take care of your family.
Yes, yes, absolutely. Thank you so much, everybody. And thank you, Valerie. Thank you, Fast Enough again. You can contact us either on social media or leave a message to Fast Enough, and we'll try getting back to you if possible. Okay, have a nice day. Bye, guys.
Bye, guys. Thank you so much for the wonderful audience.